Now, we met up at the Biohacking Congress in Miami, and I heard you on Dave Asprey's podcast before, and you're pretty, you're into biohacking. Tell me, how'd you get into that? Because I do find that doctors usually sometimes step away and try to distance themselves. Whereas I've always said this, even to Dave and others, that, there's such a small gap. It's really almost the same thing. Biohacking is the optimization, self-optimization, and medicine should really be looking to self-optimize our health, right? And get us correct. In there. But tell us your story and how you got into biohacking.
So years ago, we used to just be like, health fanatics, and now we're biohackers, right?
Exactly.
So, but I would say that my first introduction to biohacking really was at the American Academy of Anti-Aging. And I've been a member of the A4M for over 20 years. So, and since 1998, I've been going to these conferences and other ones that are similar in terms of age management, longevity, things that are looking to, ways to improve not just lifespan, but also health span, putting more, not just years in our life, but more life in our years, right? And I've always been kind of keen on that. And it was actually one of my early mentors that introduced me to that idea, even in my hair transplant training. He was drinking wheatgrass, for lunch and things like that. I'm like, what is all that? Let me taste that. Oh my God. Hopefully that's doing something healthy for you, because it tastes terrible, right? We should be playing golf on that stuff, not drinking it down. But anyway, the point is that over the years, I've been exposed to a lot of these alternative therapies and functional medicine. And so I guess I've been kind of open to it in certain ways that many other physicians had not been. In my traditional medical training, I got introduced to acupuncture as an elective in medical school. So again, that was something that New York Medical College was doing that many other schools were not at that time in the 1990s. And that's kind of opening physicians' eyes to these alternatives and maybe even ancient pathways of healing. And so I always thought about that. And I actually met Dave Asprey at the conference I think it was in 2015 or 2016, did a keynote. And of course, he was talking about coffee recipes and things like that. And I don't know if it registered right away, but I did see the coffee in the expo area. And it wasn't really until I started to try to change. I noticed that my body was changing, and not in a good way. And I spoke to my personal trainer about it, who's also, again, a health fanatic, not necessarily a biohacker at the time. And he's like, well, some of my clients are doing this coffee thing. And I'm like, I think I heard about that somewhere. This buttered coffee. And so that was really the first biohack that got me started on my journey. And because originally I was doing, I guess, what most people would consider like a more traditional approach. Like I'd make this big, blender mixture of protein and veggies and fruit, as a breakfast item, just to try to hold me off so I wouldn't be hungry for lunch. And it was actually having the opposite effect. So my caloric intake was increasing and I was gaining weight. And so the buttered coffee recipe actually started my weight loss journey. And not that I was overweight, but I just didn't like the way things were kind of, happening in my body. Things were getting redistributed in a way that was not aesthetically pleasing. And my workouts were not really that productive either at that time. So anyway, so the buttered coffee helped me. I credit Dave Asprey for that. And, we met casually at that time, but eventually, obviously, we got to know each other a little bit better. And my biohacking journey has taken me through trying to restore my sleep patterns, which were disrupted from my internship and residency program. Obviously, I wear the Aura Ring and I've been doing that for years. I got the Gen 3, which is awesome. I do try to practice meditation. I've never been great at it. So I do use things like the Brain Tap and Happy, the pulse electromagnetic field. In terms of sleep hacks, I've got the blue blocking glasses. I've, try to turn off the lights and sounds and such at night. I also have the chili pad and chili blanket and such to cool everything down to a nice, cool temperature so that I find that I sleep deeper at a cooler temperature. And also the weighted blanket helps out a lot. I wear toe shoes, so that's been a topic of conversation for my patients. They're like, "Oh, hey doc, let me see those shoes. Are they comfortable?" I'm like, "Hell no, they're not. That's not the idea. They're uncomfortable. They make your feet do what they're supposed to do." So different things like that, and of course the intermittent fasting. So the bulletproof coffee recipe kind of led into the intermittent fasting thing. So I'm 18/6, 5 days a week. And then now once a quarter or once every 2 months, I'll fast for either 3 to 5 days, water fast. So that's kind of been, the primary biohacking things that I've done, with some other little things here or there. I volunteer my time as a medical director for Gray Team, which is a local 501c3 nonprofit. We take care of military veterans. They have a very robust fitness and nutritional program, and I've brought in red light beds. So we do laser therapy, photobiomodulation beds for pain control. We have a far infrared sauna for detoxification and relaxation. We have a pulsed electromagnetic field devices for injuries, for pain, for chronic pain. We have the PEMI, the VEMI. We've got WAVIs to do EEGs portably on the scalp, and not just nutritional supplementation for traumatic brain injury, but also photobiomodulation devices for that as well. And so I brought in also acupuncture and Tai Chi and some other things, as part of the medical program there to help our military veterans basically avoid PTSD-related suicide, chronic pain, self-medication, and to provide a social circle for them of support. So we kind of bring the biohacking together with the nutritional and the other stuff, and the fitness, of course, for them as well as for us. And we get to enjoy it as well.
Yeah, a really comprehensive approach to it, an amazing cause.